I'm sorry you can't see me right now, but this is Julia Landau from Mass Advocates for Children, and welcome for being here for our chat on the new state guidance that just got issued today from the State Department of Ed about fall reopening specifically for students with disabilities. We are using a new format today, which is why we're having a few technical difficulties, like you not being able to see me right now. And in a minute, I'm joined by Janine Solomon, who you also can't see right now, from Mass Advocates for Children, as well as David Spicer and Shana Jewett-Wolf, who are communication interns working with us, trying to work out these snags. They're going to go over some of the new logistics with this new format we're using. We're hoping this is going to be a more user-friendly and more effective format for our chats going forward. We know these have been really pretty extraordinary and exhausting times. We've talked repeatedly about how we've never had a pandemic like this, where schools were so precipitously shut down and parents are left holding the bag with kids with all types and of disabilities and different needs. And now we're facing reopening, which we've also never done before. Schools are going to be reopening while the pandemic is still going on. There's a lot of questions, a lot of anxiety. We're not going to be able to answer all of them today, but hopefully we can answer some. And I think as we go through with the state's guidance, you'll see that the #1 goal of the state is to open up schools safely for as many students as possible. Video's on. Hi. Good evening.
Yeah, hi.
So before I go on, I'm going to turn this over to David to do some logistics. This will be recorded. The questions are going to be handled a little bit differently. We'll end around 8:45, but I can stay on and Janine can stay on and others till 9 if there's more questions. So David, you want to fill in on the other logistics?
Yeah. So you may note already that we're in a little bit of a different format tonight. We've upgraded to Zoom's webinar format. So we're going to ask all participants to submit their questions to the Q&A, and you have a Q&A button at the bottom of your screen. If you see someone's question that you really like, feel free to give it a thumbs up, a like. So I'm going to be reading your questions throughout tonight's chat during our question breaks. And just as a word of note, all participants' videos and sound have been turned off for this chat.
Okay, so people can ask questions there. They can still share things through the chat with each other if they want. And give us any feedback if something's not working with this new format, but hopefully you all will like it even better. So next slide, please, Shana. As I said, the state did issue their new guidance today around how to reopen schools safely for students with disabilities. And generally, before we go into the weeds, you know, it's been confusing. Schools closed March 15th. There's been a series of guidances from the state about how to open up for the summer. Then a couple weeks ago, the state issued guidance for all students for fall reopening. But now, as of today, we have specific guidance around special ed and students with disabilities. So the 4 main principles are schools are supposed to open up for as many students as possible who can be getting in-person education safely. There's a range of school health and safety requirements that we're going to go over pretty briefly, so you have a sense of the major ones that are a little bit different than what was required over the summer. A third major point is the state has really emphasized the importance of parent input, parent communication, and engagement in each step of this reopening process. And I mean, you all know how important that is for your students to really be able to benefit from whatever this new education looks like. And throughout the guidance, the state, recognizing that schools may not be open every day, full days for all students, they prioritize making sure that students with more complex and significant needs and young preschoolers are receiving full-time in-person learning. So I'm going to go on to the next slide from there. So I'm going to just briefly go over some of the health and safety requirements for what schools are going to look like generally when, in terms of social distancing, as students re-enter. First, the minimum requirement for how far students stay from each other and is the desks have to be at least 3 feet apart. 6 feet if possible, but no closer than 3 feet apart. Desks all have to be facing forward. There are no class size limits. There's no limits on the total number of students in school because the state has said that the 3 feet social distancing is what is going to kind of determine how many students can be in a school or in a classroom at once. It'll be more based on the 3 feet and the size of the building and the classrooms. School districts are advised to divide students into smaller groups and cohorts that are isolated from each other. They recognize that'll be even trickier for middle and high school students, but they're still encouraging districts to really minimize how often the student groups are interacting with each other. Districts are also encouraged to use other spaces in their building for classrooms, to use if they have an auditorium, if they have a library, if they have a cafeteria. And they're also encouraged to use community spaces that are open and already have procedures in place in terms of safety, whether it be community centers or libraries, to explore those options so that as many kids as possible can be in school safely. Next slide, please. A lot of parents have questions about masks. Masks are going to be, or face coverings are required and are supposed to be provided by the family. They're not going to be required for first graders and younger students. They're not required if it's necessary to accommodate students' disability or health needs. The state encourages transparent masks for students who are deaf or hard of hearing. This wasn't emphasized in the current guidance. We're going to get more guidance from the state, but we know that for students with autism and other types of disabilities, transparent masks may be really important in terms of being able to read visual cues and learn to read visual cues. And the state is requiring mask breaks, and they're going to be issuing more guidance about that, but they recognize that kids and adults, frankly, are going to need breaks from wearing the mask. And so they're going to give more guidance about how to do that safely. And then next slide. Thank you. What you would expect, they have specific hand washing requirements. Like for the summer, they're not requiring temperature checks. They have very specific protocols, and they're going to be giving more district guidance about cleaning and within the building. And for students with disabilities, they're going to need one-on-one hands-on assistance or services. The staff have to be trained about how to do that safely, and they have to wear additional protective equipment. There is not yet guidance about transportation. I know that's a big, understandable worry for a lot of parents. The state is going to be issuing new guidance before schools open about transportation and how that should go safely. Next slide, please. So basically what the state has told every district to do, and we're going to be curious to hear, I don't know if this is relevant to the polling question, Shana, but how your district has reached out to you, is every district has to develop 3 plans for school reopening. They have to be now developing a plan for in-person learning for all students. They have to be developing a plan for a mix of hybrid in-person and remote learning. Here's a question about whether or not your child's received any in-person services over the summer, just to see how far along your districts are. And then they also have to develop a plan simultaneously for providing a full day of remote learning in case schools have to close down again. They're asking districts to plan for the entire year. Because basically what the state is saying, middle of March, nobody really was prepared for this. Schools closed and schools didn't have time to plan how to meet the needs of kids with disabilities. And they're saying now you have time. So there's going to be some students for whom it's not safe to go back to school, and we need to know that it's possible that all the schools might be closed again in the future if we see a spike in numbers. So by August, your district is supposed to be submitting a plan to the state with all 3 plans. They're supposed to be conducting a family survey. I think we have a question about that, but I'm not sure. To get information from you in your district about what your preferences are and your concerns are. And they're supposed to have a district and a school COVID team that's planning reopening, that is encouraged to involve parents. So here's the question about whether or not you've received any kind of survey to ask for your input around school reopening. Should we go to the next slide? So I don't know, maybe I'll go through some of the slides about what the state says about in-person learning. We're going to talk about the in-person learning requirements and the new remote and hybrid learning requirements for students with disabilities. So for the in-person learning, being primarily in the school site or in another safe community site, the state has said that students with disabilities have to receive as much in-person learning as possible. We know for students with many types of disabilities, remote learning is very challenging, and being isolated at home is very challenging. The second main point that they've emphasized is that services have to be provided in the least restrictive environment. And the reason they're emphasizing that is because as districts figure out their social distancing requirements, it's going to be challenging to implement IEPs because some students go from a pull-out resource room or substantially separate classroom, and then they go in another cohort of kids that's in a gen ed setting. Or some students are in the gen ed setting, but there's service providers, speech therapists, or others who are going into that classroom, but going into other classrooms. So the state has really emphasized that as the state figures out the numbers of students, the groupings of students, they really need to look at kids' IEPs and make sure that they're still having as much opportunity as they can to participate safely with their non-disabled peers. So there's a lot of challenging things where districts are really going to need to be partnering with you to figure out what's right for your kids. I guess in a break, we'll show the results of the survey questions so far. Is that right, Shayna?
Which one are you talking about?
And people are wondering about the results of the polling, so maybe you can give that to people during the break for questions.
Yeah, I had been streaming the poll answers after people had answered them.
Okay, I can't. It's a new thing. I can't see them myself, so I can't comment about it.
Were you guys able to see that? The results?
Services, and then the third main point in terms of in-person learning, there's many points in this guide, is to realize that the IEP may be implemented differently, just the way we're talking about around inclusion and least restricted environment, even for the students who are receiving their IEP services in school. And we know it's also going to be implemented differently for the students who are full-time or part-time in using remote learning. So it's going to require a lot of creativity, and it's really going to require a lot of collaboration with families. Next slide, please. So here's some examples of the kinds of things the state has been encouraging districts together with parents to think about. So there's some kids who have pushed in speech therapy or occupational therapy. More than half of those parents have gotten some kind of survey, and about a third have not, which is not great about school reopening. So for students who need speech therapy provided in a gen ed setting or even in a substantially separate classroom, they may not be able to have the speech therapist go right into the classroom because of the safety requirements of not merging contact with many different cohorts of kids. So what the state's recommending is to look at whether or not the speech therapist in the school might be able to provide teletherapy in the classroom and maybe train the paraprofessional for how to support the student for the teletherapy push-in services. I mean, this is just an example of the kind of creative things that school districts are going to need to be thinking about. And to really, as we talked about, to look at flexibility, how to set up the student grouping so you reduce the mixing, and to make sure that the cohorts and groups that are put together really look at the IEP goals of kids to make sure they're in groups where they can have a chance to learn the skills that are prioritized in their IEP. Next slide, please. And maybe after, I don't know, do we have a lot of questions?
Yes, whenever, if now is a good time.
Well, let me do this next. I've got a lot of, let me do this next slide and then maybe break for questions. A lot of parents have already been asking our office is if they're worried, if you are worried about the health and safety of sending your child to school for in-school services, do you have to, or what do you have to do if you don't want to? And the bottom line is you as parents, you know your kids, you know your family, you know your community. If you can choose and make the decision about whether or not it's safe for your child and your family for him or her to go back to school. The schools still have to implement the IEPs for your child through remote learning. If you decide it's for safety reasons, you need to keep your child home. There's no doctor's note required. You don't have to go through all the forms that are regularly required for kids who get home or hospital-based services. It's obviously every family is going to have to make a decision about what makes that, you know, every student has different types of needs. Every family has different risk factors within their family, and the state will be issuing more guidance, but it seems very clear that they recognize these are parents' decisions. The state has also emphasized that for children who do need to remain at home, either because of the parents' decision about safety or because of what may happen in the future with hybrid or other models requiring remote learning, they're encouraging school districts to strongly encouraging them to look at providing in-person either home services or services in a community-based setting where they could provide one-on-one services for kids, especially for those who have the most significant and complex needs and are going to have more challenges learning effectively remotely. That's a big issue for unions. Teachers don't want to be going into other spaces unless they know that there can be adequate safety precautions. And the bottom line of everything that the state's advising is whatever's done has to be done in a way that's safe for educators, safe for families. And so we're going to, I'm sure, be hearing more about the provision of in-home services by school educators and service providers. So why don't we do a few questions and they go from there.
Yeah, sounds perfect. So I would say the most popular question. So a couple parents want to keep their students 100% remote for the fall for a couple reasons, family or just health. What is the way to make sure that request is going to be honored for those families?
Well, again, this is just, so, you know, the districts are just, did we already do this polling question, Shayna?
No, we didn't do this one today yet.
Oh, okay, that usually goes first. Sorry, that distracted me. The state has been, again, in their guidance from the commissioner and the guidance today from special ed director from Russell Johnston, who is in charge of special education. It is a parent choice. So I would say if any parent I would say make it clear to the district that your choice, at least from what you know right now about the situation for your family and the district is for your child to stay home, then to notify the district of that. And if there's any, and that you want, and we're going to talk about that your child's IEP should still be implemented fully in this coming year remotely. And that's, of course, what you would expect, and that you want to work with them collaboratively to figure out how to do that. If that's not going smoothly, that's where our helpline comes in. You know, please contact our helpline. I'm sure that the state, as well as our office, will help you to make sure that your child can remain safe. The state wants as many kids as possible to be in school and to do everything to make sure that parents can see that it's safe enough to do so. But if it's not for your child, you should not receive any pushback from the district.
Awesome. Another great question. For students who have underlying medical conditions and are in special education, is the district considering or the state considering sending one-on-ones to those students' home environment?
Yeah, we just talked about that.
Okay, perfect.
We did. That question may have come in before we were talking about it, but yes, they are absolutely talking about that in the guidance. But the state is still figuring out how to make sure that that can be done safely.
Okay. Another question we have here.
And that they have said to prioritize students with the more significant and complex disabilities. for the home services.
Great, great. Another one. So for students who can't wear a mask, is there a possibility for a waiver? And if so, what would that kind of look like?
That's a good question. As we said at the beginning, children with disabilities do not have to wear a mask if they're unable to do so, to accommodate their disability or to accommodate a health issue. For their respiratory issues, they may not be able to wear a mask effectively. We have not yet gotten guidance from the state about whether, I'm assuming that the parent can just inform the district of that with some kind of email, but I think we'll probably get more guidance. I'm sure districts are going to be asking that as well. But again, at this point, if that's something you know about for your child, our advice around, you'll see, and maybe we should go on to the next slide about parent engagement and communication, is to start informing the district about what you know your child is going to need for reopening. Because whenever your school district starts end of August or September, it's going to be here before we know it, even though every day must seem very long at the same time. So as we said at the beginning, the state has made it very clear that parent engagement, communication, and notification are key for every step of this process. So what the state has said, and a lot of this may not happen until schools open, not all the teachers are there, but that's why we're encouraging parents to go ahead and email or contact the educators, the team leaders who may be available if you have concerns that are really important to address with reopening. But as staff come back, educators have been advised by the state to reach out to every parent individually to discuss with them how IEP services might be provided differently for their child, in the school, the way we've been talking about, as well as if it is remotely. And the state's made it really clear that they know, and districts understand this, that you have been the ones on the front line with your kids for these last many months. You have been the one who've been seeing how effectively or not effectively they've been learning, what the impact on them has been of being without services, of dealing with the amazing amount of health and anxiety and other factors that families are dealing with. And so families and districts need to share information with each other. The district then needs to notify each family in writing about any changes in how the IEP services are going to be provided in the school district, in the building in person or remotely. And they need to let you know how, where, and when the specialized services are going to be provided. Like the examples we talked about, if your child's going to be receiving teletherapy because of social distancing requirements instead of in person, they need to let you know that. And the communication is supposed to be two-way, not just the district informing you about what's going to happen, but getting your input to understand your child's needs as they do this. The state, people are probably familiar with the remote learning plan that was required for the last, since March 15th. And the state is saying there's going to be a requirement to issue some similar kind of written notification as what we're all used to with the remote learning plan. They're going to be providing a template the way they did for the spring semester of school. It's not yet developed. So a district can use the state template, or they can use their own form, the N1 form of the IEP, as long as they provide all the required information. Okay, this is making sense. Next slide. The state guidance, which I think Shane has provided you a link to, this document, I can't remember exactly how many pages it is. Mine is already dog-eared, even after just printing it out this afternoon. But IEP teams specifically have to consider information from you about your experiences during COVID thus far. They need to hear from you what you think your child's primary areas of need are as schools reopen. And they need to hear from you about any challenges they may have faced in terms of accessing remote learning. Because as the district plans, if your child's going to be part-time in this school and part-time home, they need to know about challenges so that remote learning can be, now with more time to plan, provided more effectively. And we also know that it's possible the schools may have to close down completely if the numbers surge to the point that this governor decides that's necessary. So now is a time where you can start, the district will be reaching out to you, but our advice is that you can also be starting to reach out to the district to let them know what you think these primary areas are that you're hoping the district's going to address as they make these decisions. Next slide, please. We're doing a lot of slides here because I think we all know that the whole basis of special ed law is, in the idea of an IEP team, is that we want school districts and parents to really be working together and communicating effectively. And pre-COVID, I think school districts and parents would all agree that that doesn't always happen as effectively as it should. And I think what's really become apparent in these months, when effective parent communication and collaboration is so essential, is it's worked in some instances, but in way too many instances, in part because the school districts were just reeling with trying to figure out how to provide remote services without time to plan for it. Many districts did not have the time or capacity to really be reaching out and regularly talking with families the way it's going to be required. So what the state is, that's I think in part why the state is emphasizing to school districts what we all know in the first bullet, that the school closure can have a big impact. You may have seen your children regress. They may have developed new areas of need like anxiety. So they've emphasized how important it is to partner with you and to consider, even with reopening, you know if your child has a disability that makes it, like autism or other disabilities that make it difficult to respond to all the many changes in routine they're going to have to experience, or if your child experiences anxiety. And so now is the time for you, with your expertise about your child's needs, to think about, if they're going into the school building, what's going to make that a smoother transition? Should there be social stories? Should they get some virtual tours of the building, or introductions to the staff, or actual time safely to go into the building to see the new configuration of desks? You know your kids, that the school is going to be reaching out to you, but it's also completely important and appropriate for you to reach out to them about what you think is going to be needed for effective in-person learning and for effective remote learning, if that's where your kid is. And lastly, in terms of parent participation, next slide, is the state throughout their guidance to districts has continued to emphasize that districts have to be communicating in the parent's primary language. Again, communication is more important than ever right now with COVID, that districts have to use trained interpreters and translators, and the districts have to provide parents whose primary language isn't English with a contact person in their district who they can communicate with if they have any questions or any concerns. Who can they contact that they can talk to in their primary language? Lastly, next slide, in terms of in-person education, and then we're going to talk about remote learning with a hybrid model, or for kids who are staying full-time at home. There's a big concern that our office has had and the state has had, and I'm sure educators have, about many students with disabilities are going to have difficulty complying with all these new social distancing requirements. There's a lot of new rules, and students, because of their disability, may not be able to effectively comply with all the new requirements. And also because of the way they've been impacted by these incredibly stressful months, they also may not be as readily able to respond to all the many changes as schools are reopening. So what the state has said really clearly is that discipline should always be a last resort, right? But especially now, with what's gone on for kids, with what's gone on for our communities, discipline should be the last resort in response to non-compliance with any of the social distancing requirements. Schools should be checking in with parents proactively to, like where we talked about, to plan for smooth transition. Before any discipline, the state has said that schools should really consider what the impact on the behaviors may have been by the pandemic or from being away from school, and to really focus on more on positive behavioral supports and restorative justice and other alternatives to discipline. That's always the case with discipline, but it's more important than ever with the challenges that everybody's going to be facing. Teachers are going to be stressed about and worried about health. Students are going to, I'm sure, be feeling a lot of anxiety, feeling everybody else's anxiety. And so this is a really key and important protection that's in the guidance. Should we open up for more questions, Dan?
Yeah, I think right now is perfect point.
I'm gonna note I'm gonna be launching some polls. Is that okay, Julia, during the Q&A?
Yeah, why don't you do one poll now while during the Q&A would be great.
Yeah.
Okay.
So if districts are providing in-home services, will the teachers be highly specialized instructors or certified teachers or tutors, or what sort of home services should parents expect?
That's a very good question. It really depends on what the student's IEP services are. What the state has also said really clearly is that, there's another poll about what you've observed about your child's progress, is that unlike what a lot of families and children experienced in these last several months, schools need to prepare to really fully implement IEPs, even if it's remote instruction. So the type of person that's going to be providing the service depends on what's necessary to implement the IEP as it's written. So if the IEP calls for speech therapy, then I would assume it would need to be a speech therapist who's providing the in-person services. It really depends on if it's specialized instruction. For a child who's deaf or hard of hearing, then it might need to be a teacher who has the right skills and license to teach a child who's deaf and hard of hearing if they happen to be deaf and hard of hearing and also be compromised in other ways that they can't go to school. So it's gonna, if the service providers have to be able to implement the IEP. I think that's as general as we can say, and call our helpline if you have more specific questions.
Awesome.
You can jump in with any answers here too. Again, this is all new. I'm telling you what I know as of this afternoon and what we know about law generally, but it's a moving target.
Yeah. Another question for you. Does DESE's guidance or any guidance include information relating to the transition programs for 18 to 22-year-olds?
They do. We'll get to it later, but I'll just answer it now. They basically have made it clear that they realize that for the students who are older, 14 to 22, who need transition services in the community, that basically what the state is saying is that they understand that community-based services can only be provided in the community if it can be done safely, the same way with every part of education right now. It has to be done in a way that's safe, safety first and foremost. And as more things are opening up, that would in our state right now, then there may be more opportunities to provide community-based services in a way that's safe, complying with the social distance requirements. So the state has strongly encouraged school districts to look at providing community-based services safely as it becomes more possible to do so. The state has also said that they hope, no promises, in the next couple weeks they'll have their new guidance around compensatory services, about how districts should make their decisions about individually what kids might need if they didn't get all the services they should have from March onward. And they've said they are going to definitely be prioritizing what districts should be doing for students who turn 22 in the months since COVID, since those students are particularly betwixt and between right now.
Excellent. And then our third question. So if an IEP is initially written as going back to school full time, should the IEP amended? Should the kids be switched to going remote or a hybrid model?
I should have talked about that before when I was talking about parent engagement, so I'm really glad we have this question. It is like it has been for the last 3 months. The IEP should be written as if there was no COVID and schools are fully open. And then, and that, for those who are familiar with this term, that will remain the state put placement, as things go forward. That's the IEP should reflect what your child needs when schools are fully open. And so then as the school district for this coming school year figures out how to implement the IEP differently, they have to involve the parent in figuring that out. They have to notify them in writing, but it is not, and they could, if you have an IEP meeting coming up, the state was saying that this could be discussed in the IEP meeting. A parent could ask now. You may want to ask now for an IEP meeting if you feel like this is a chance to talk about these things. But the fact that your child might get teletherapy instead of in-person speech therapy wouldn't go in the IEP service delivery grid. It would go like in the cover page where you document how the services will be provided differently, because you want your IEP to keep reflecting what your child should have as soon as school's open fully.
Sure. Then one more question. So will 3-year reevaluations resume in the fall if there's only remote learning?
Well, there should not be only remote learning, as long as, for right now, what the state has said is that schools should be preparing to open up, ideally fully for all kids. It may be a hybrid model for some. We've heard that some districts have already announced that they're only going to be doing a hybrid model, that there'll be a combination of remote and in-person. But the state has said as long as the schools are open, they need to be continuing to do the IEP meetings and the evaluations in person, complying with the social distance requirements. So should we go on to the next slide? So if your child is either going to stay at home because of the safety considerations of being in school part-time or full-time, or if your school district decides that they can't open up for all students safely full-time, so that students are going to have some kind of mixed schedule. They'll be in school some of the time, and they'll be getting remote learning some of the time. The school district might decide to do that week to week or part days. It's a lot of families who are working are trying to figure out how to deal with childcare if that's the situation. But if a school is decided that they cannot open up fully for all kids full time, then even under that circumstance, the school districts are supposed to prioritize full-time in-person learning for preschoolers like we talked about, and students with complex and significant disabilities. So very briefly, and this is more detailed, next slide, but a lot of families are asking how is the state deciding or defining who the students are with complex and significant needs. And there's 6 different groups of kids. And you may not even be aware of this, but there's an administrative form that's part of your IEP where the district calculates the amount of special ed services your child gets, where they get the services, and how much of the day they get their services. And they define which students are high needs and moderate needs and low needs. So any student who has been determined to be high needs on that page of your IEP, and we can give people more information about how to find that later, would be considered a student with complex and significant needs who should be prioritized. Students who can't engage in remote learning due to their disability, again, you as families know that probably even more than school districts do at this point, since you've lived it every day. Students who primarily use augmentative alternative communication, whether it's low-tech devices like PECs or iPads or computers with Dynavox, with voice output systems. Students who are homeless, students who are in foster care, and students with disabilities or English learners are all considered students with disabilities who should be prioritized for full-time, being offered full-time in-person school learning, even if it's a hybrid model. Next slide, please. So what the state strongly emphasized is that remote learning for the coming school year should look very different than it did from March through June. Again, school districts did not have time to plan ahead for remote learning, but now they do. And so IEPs are supposed to be fully implemented, even remotely. Students have to receive direct instruction and services, structured lessons, video-based lessons, teletherapy. Before, in these first months, the state had said that districts can also rely on what they call resources and supports, like packets and assignments. But the state has said, like, when schools are open without COVID, of course, schools can supplementally provide assignments and homework and things, but going forward, remote learning has to be direct instruction and services. The state did talk about for students who maybe have full-time instruction with special ed, they may not be, as they talk with the family, be able to be locked into Zoom instruction all day. And so then, of course, the state was saying the school may provide different kinds of packets and assignments to students that they would be able to handle on their own independently or with some kind of support of somebody from the school district. I'm going to go a little faster because it's already 8:42. Next slide. So remote learning now, differently than in the spring, has to include a regular schedule of these IEP classroom instruction services and therapists. It has to include a schedule that involves frequent and interactions with teachers directly, not just receiving information that's sent home through the internet or through the mail. And we talked about the supplemental work already. Now, a lot of families are asking, next slide please, how are districts going to do this? And so that's a lot of what districts are supposed to be doing now, is to figure out where are the gaps, what kind of training do teachers need, what kind of training do speech therapists and other service providers need, so that they can more adequately provide remote instruction that's effective for kids. We talked already about transition services for older youth. We already talked, because your questions are so good, about how evaluations, reevaluations, and IEP meetings are supposed to be going forward, and more of them, some of them may occur remotely but the school districts still are supposed to be reaching out to families and working out collaboratively with them what's the best way to go forward with their IEP meeting or their evaluations and their reevaluations as close as possible to the timelines. They're hugely backlogged now. It can be in person, as long as it can be done safely. I'm sure in many instances it will probably still need to be done virtually or with some kind of social distancing requirement. One special ed director today in a chat suggested maybe the parent could be meeting in person with a teacher, and then the other people could be joining remotely. I mean, I think everybody's going to have to work together creatively to figure out how to meet the spirit of the law, as much of the letter of the law as possible, in a way that makes sure that everybody's safe, first and foremost. Almost done with slides. Next slide, please. There are some very specific provisions around the 3- and 4-year-olds with disabilities. If kids turn 3 while schools were closed, they now have the chance to stay in early intervention until the middle of October. School districts are going to have a backlog of assessments and IEP meetings that they need to hold for 3-year-olds, because by October 15th, the district has to be ready to start providing special ed services for kids with disabilities who are 3. And so districts have till October 15th to complete the IEP meetings and evaluation procedures. The state's given some very specific guidance around students with low incidence disabilities. So if you have a kid with a high risk medical condition or visual impairments or deaf or hard of hearing, you can look to the guidance or call us with questions that you may have. And I believe the state's going to be issuing more guidance about more low incidence populations as we go forward. So bottom line, what can you do now? And then we'll open it up to questions if folks want to stay past 8:45. Next slide, please. Our advice is to contact the district, send an email if you have concerns about your child's transition to the fall, if you have concerns about how their IEP can be implemented safely in the school, if you want to be able to engage with them, begin engaging with them about how to provide services in as inclusive setting as possible, you will have ideas that will help the school district figure out how to meet your child's needs. There are less school staff available now than there will be when schools open, but it's completely appropriate to start reaching out to the district now and inform them about how your child's been doing. The way the state has said the district needs to learn about how they did, have they regressed, other areas of new need, and ask your questions about health and safety and ask your questions about your child's needs so that you can figure out whether or not your child can hopefully go to school in person in a way that's safe for you and your family. It's never been done before. I think the state's really been clear that this has to be done in a way that's safe, but it's going to take a lot of communication and collaboration to make sure this can be done, and every family has to decide what's best for their child and them independently. There's other slides here about what you can be doing, using our app to document about how your child is doing. Next slide, and the who you can contact, complaints you can file. The state will be, as I said, issuing guidance around how to determine if your child's entitled to compensatory services. That should be coming out in the next 2 weeks. And we've got more resources for you. Let's open it up to questions. That was a lot of information really quickly. I hope it wasn't too overwhelming.
Yeah.
Julia, would you like me to do another poll?
Yes, please, Shayna, sorry.
Okay.
You keep doing them while we're talking.
Yeah, so one parent school is saying that the school only has to provide IEP services as, quote, as best they can. The parent thought that they need to meet a service delivery chart, service delivery grid for different resources, even if remote, rather than grouping kids and non-specialized reading instruction. Which way is correct?
I'm not sure I could follow the question exactly, but I think that's part, if I'm understanding it correctly, and I apologize if I'm not, I think this is the difference about what the state guidance was before and what the state guidance is as schools reopen. The state is expecting schools to implement IEPs fully, even if a child is getting remote instruction. They did not expect districts to do that right away when schools closed down, because they knew they had to get the infrastructure together, get the equipment together, train teachers. But as the school year begins, the state is really clear. The person explaining this guidance said that they believe that no child should need compensatory services starting next school year, because their IEP should be fully implemented, whether they're remote part of the time or whether they're in school the full time getting services differently. That's that's the hope. That's obviously what the law requires, but it has to be done in a way that's safe. And I think the only way we can even come close to getting kids the services they need in these new ways of providing services is if the district is really genuinely engaged with you as parents, problem solving, because we're going to have to figure out creatively what's going to work for each kid.
Great, thank you.
Here's a question about how you would prefer for the school to notify you about how your child's IEP will be implemented. Again, as we've told you, the school is supposed to be contacting you as they figure out how they're going to implement your child's IEP, but that was asking your preferences.
Awesome.
And great.
Awesome. So we covered that districts are going to try prioritize high need students to go every day, whereas like other students might go hybrid. How can we ensure that the high need students are being included meaningfully to learn social skills and just learn from their peers overall?
That is a really excellent question. Again, the state has said, number one, that they want all kids with disabilities to be getting as much in-person instruction as possible. The goal is what the state has said is that every district should be trying to open up, at least offer full-time instruction for everybody. But as you said, if they're unable to because of the social distancing requirements and you end up in the hybrid model, It's like everything is special ed law before COVID and after COVID. The only way I know to help ensure that the kids, the preschoolers and the other kids who are, have more complex needs get services is to reach out to your teacher, reach out to your team leader. Everybody's gonna be a little bit overwhelmed. So the more that you as a family member reach out and make it clear why you think your child, meets the criteria and what you think will work for your child, I believe it's the same kind of parent participation and parent advocacy that hopefully can make it work. And again, you can contact our helpline if things are not going smoothly.
Awesome, thank you for that. Another question for you. So what will districts do to make sure that grouping kids by like or similar IEP goals isn't leading to segregated spaces?
That is, again, I know the state has told districts that needs to be a #1 concern that they're thinking about as they figure out what the different smaller groups of kids are going to be. And at the same time, if I were a parent and I had that concern, I would now contact whoever you best connect with in the district, whether it's a teacher or the team leader, and express to them your concern. If you have a proposal of how you could imagine doing the grouping, depending on, I don't know if this is a 3rd grader or a 10th grader, you may have different suggestions of how to make it work. The state has said that as they divide up the cohorts, they need to be looking at kids' IEPs so that they're giving kids a chance to be included as much as possible. They've also said work with parents to think of creative solutions, of how to bring kids together in terms of peer mentors. I don't know. Can there be any kind of video, remote way of having students participate inclusively? It's never been done before under these circumstances, but I cannot imagine how districts are going to be able to figure this out without really hearing from you as a parent. I know the state's been working with some inclusion experts who are also trying to help figure out some creative solutions to how to make this work. Think about even social skills groups, like for a lot of kids with autism have social skills groups, but the social skills groups are not always kids that are in their own cohort of kids, right? So every part of, there's gonna be a lot of parts of kids' IEPs are gonna take some real creative solutions to make it work.
Great, yeah. So if a teacher or instructor is in a high-risk environment outside of the classroom, maybe a second job in terms of being exposed to COVID, what are the safety requirements being implemented to protect children, especially those who are immunocompromised?
That's a really good question, and I don't know the answer to that. I don't know if that's something that the state has addressed or not. So if you whoever's asking that question wants to contact us, we can look into it and let you know if there's any guidance yet from the state about that. Again, the state is issuing more guidance around all of this. But what I would, I don't mean to sound like the broken record, but if you have a child who's immunocompromised or for any reasons that's a concern, I would suggest you put that in writing now to the district and ask them, because every district and school is going to set up their own internal policies. So that's why it's so important. Any question you have about safety, you need to ask, you need to get a clear answer. If you can't get a clear answer and you need help with that, please contact us, because figuring out how to do this safely is really important.
Great. And another great question for you. So do you think it'll be the case where some teachers may refuse to go back to school without more help to implement these guidelines? And should a staff shortage be something parents are concerned about?
I just also want to recognize the time. It's 5 of 9, and so we should probably do the evaluation poll, because I know some people need to leave earlier while but we can keep going with questions. I know that there are a lot of discussions going on with school districts and with unions. Everybody, parents, teachers, administrators, wants kids back in school, and they only want kids back in school that are going to be safe for kids as well as teachers. There may be some teachers who decide not to come back, but it is expected that schools will be fully staffed. School districts are also challenged with how are we going to provide both remote instruction and in-person instruction at the same time. There's going to be a lot of challenges even with existing staff. I think that's another reality. So I don't have a crystal ball to how it's going to work, but I know that that's why these reopening plans, these reopening groups that are supposed to be set up in your school district and in your school, they're supposed to be encouraging parent involvement. So you could reach out to your school and ask them some of these questions, about how they're planning for this.
Awesome. Do you have tips for parents to best advocate for compensatory services? I know we have some parents who haven't had OT, PT, or speech services since March.
Yes, as I said, that the state is going to be issuing guidance for school districts and families about what they think the process should be for school districts to communicate and meet individually with families to figure out whether the child needs compensatory services, and if so, what type and what amount of compensatory services. They're hoping to issue that in 2 weeks. It's possible that our next chat, which will be 2 weeks from now, will be about compensatory services. If the guidance is out, that will be the topic. I think it's fine to reach out to, if you have a child who turned 22, if you have some major concerns about compensatory needs, you can certainly reach out to the school district now to start that dialogue. But I think districts are going to wait until they get the guidance from the state to know exactly how to, they're going to have a lot of meetings with families, many families, to figure out what kind of compensatory services or additional services kids are going to need. So stay tuned.
Yeah, awesome. This may be our second or our last question of the night. When should face-to-face learning start for ESY? Some have started now, while some aren't starting until the last 2 weeks.
I'm glad that there's some face-to-face learning happening. There is it couldn't start before July 6th. And then what the state is saying is that every district should be moving as quickly as they can and start it as soon as they can safely. So the state has said if you can't start it until August, then keep going and start it in August. But they do have to provide it for as many kids as they can, as soon as they can do it safely. So it's very uneven, district to district, is what we're hearing from families. We have heard from families that those who've been, the state has been very clear that there can be no no blanket statements. Districts cannot legally say, we're not going to provide any in-person services for any student this summer, who has ESY services. So if your district is just saying carte blanche, they're not even going to consider or try, that's something you can call our helpline about. We have heard from families who've done more advocacy and reached out, and I believe one filed a PRS complaint that they were able to negotiate getting some, IEPs are not necessarily fully implemented, but they're getting at least some face-to-face services.
Right. So we know from this past spring that getting access to devices was a big challenge to remote learning. So this fall, if we have either hybrid or full remote learning, what kind of support can parents expect from their schools in terms of remote access support?
Great question for our last question of the night. If you have more questions that we haven't answered, please feel free to contact our helpline. I'm sure Shada will drop that in as we're closing up. And you did the poll, right? You did the evaluation. I'm not able to, I can't multitask.
Yes, we got them all.
The state, that's one of the things that the school district should be trying to get information from families if they're having difficulty connecting to the internet, if they don't have a device, or if they need more support around tech issues in order to effectively use remote learning. We strongly advise that parents notify the district of that fact, and if you still have problems, to call our helpline. However, and I can't I know somebody from the state is on this. I don't know, Dean, if you can remember the deadline. The state has a grant opportunity open to all your school districts in order to get the state is giving matching grants to districts to buy devices to provide a year of internet for families who are not currently connected or not currently connected with high-speed enough internet. So I would encourage you, if that's an issue for you or for your community, to reach out to the state and make sure that they're applying for one of those grants. We can, when we send out the information about the chat, we'll include information about this grant opportunity, because the districts can also get state funding, not just for devices and internet, but for assistive technology that students with disabilities are going to need in order to access remote learning. So it's a great opportunity for your for districts who really want to make sure that every child has their own device and connectivity can get that. But please contact us if you are having trouble with connecting remotely. It's a huge priority for the coming year in terms of any kind of equity. So it's 9 o'clock. Thank you for staying on, because so many people stayed on so much longer. It's a lot of information. It is a very unsettling time. I think with a strong parent voice, strong parent involvement, it's more likely that kids will be able to enter school safely, get their services implemented in a way that's more consistent with their needs. Thank you for all your interest, your support, and we will be back in 2 weeks. And sorry, these times are so difficult. We know that they are much more likely to get what they need with your active involvement. So thank you, and have a good evening.